many of you know much about what a medical assistant is and what they do. Well, that's what I'm here for. First, I'm going to define a medical assistant. Basically, our job is to assist a physician, whether it be clerically or clinically. For example, I worked in an OBGYN office where my job each day was to open the rooms, set up the equipment, room the patients, and do a quick detailed intake. Once the provider was ready, he would ring the bell, and I would open the door and begin my job. Um, as with most jobs, you get on-the-job training, because remember, no two doctors are alike. I have a doctor that might like powder-free gloves and another doctor that might like latex gloves. So it all depends on the provider. Second, as a medical assistant, you can work in a variety of settings. It doesn't just have to be, as I said, gynecologically, like where I worked at. You can work in a doctor's office, you can work in the hospital, you can work in nursing homes, wherever there's a requirement or a need for a medical assistant. As I stated earlier, you can work in the clerical section or administrative section, answering phones, greeting patients, checking in or checking out. You might even be required to do charge entry. It all depends on the place, the hospital or establishment. Um, then we have to go to the clinical side. On the clinical side, that's where you go and you assist the doctors with procedures, you clean the rooms, you do the ordering. For example, I did all that, and plus what I had to do was also give injections when the nurses were busy, which was 95% of the time. And also do some patient education. Really, patients, when they come in and they have a birth control talk to them about the different options that they have, give them brochures and information on it, and just be as helpful as you can towards that. Another thing that I did was surgery scheduling, which was very intensive. I had to deal with insurances, with the hospital, with scheduling the OR room and which site they were going to go to. It was, like I said, very extensive, and had to double check and triple check my work to make sure everything was done and ready for the provider. If you're a passionate person, a people person, and you love the healthcare field, this is a good option for you. I'm going to go towards education now, okay? As far as education goes, you can get an associate's degree or you can get a certificate. The difference is an associate's degree is 2 years and a certificate is 1 year. As far as pays go, I'm not sure what's the difference in pay, but it really depends on you and what you want to do. In my case, I had to do a certificate because in my situation, I had just given birth and all I had was a high school diploma, and I needed something right away that I can do quickly and would help me start earning money that's not based on a high school diploma scale. Also, regarding salary, I went to salary.com and I typed in medical assistant. As you can see in the chart below, the salary ranges from $24,080 beginning in the 10th percentile to $33,351 being in the 90th percentile. Being a medical assistant or even working in the medical field, you have to be susceptible to change. You have to be able to accept change. Technology is advancing, things are always changing, and you have to be going with the flow. You can't just say, no, I don't want to learn this, and no, I don't want to do that. You can't. There's not no in the medical field. Which is why I wanted to talk to you about too. Sometimes you might be required to work different shifts. You might be required to work weekends. You might have to work holidays, depending on where you work at. In my case, I worked a Monday through Friday job, 8 to 5 p.m., no holidays required, which was excellent for me and my family. But like I said, it all depends on where you plan to go to work at. Now, some people might wonder, does being bilingual mean you get paid more money? No, it doesn't. Well, I should say it depends on where you live. In my case, it didn't. Our establishment, our hospital, doesn't require or doesn't pay more because you're bilingual. Actually, in your your application status when you go to apply, it's a requirement. They would prefer bilingual. So just by you being bilingual doesn't mean you get paid more money. However, in my case, I would be considered first over someone who wasn't bilingual. And that just being in my office where I worked at, 70% of the population were Hispanic. They were Spanish speaking. So my services, just my skill of being bilingual was needed. You have to consider also the pros and the cons of being a medical assistant. Pros being you have two options on how do you want to go to school, whether you want it to be a certificate, a degree, 1 year or 2 years. Also, there is no further education in medical assistance. Once you get, either the associate's degree, that's all it is. And really, you can't do anything more than that unless they do some in-house training and you learn something new there. Like in my case, I did the clinical aspect, everything in the back. I learned the front. I was cross-trained. I scheduled appointments. I used complex systems in the computer. Also, I did charge entry, and I started to go to do other things and other things. But as I said, it all depends on you, on the person, and really the site. Um, Also, another thing is that once you're a medical assistant, that's really all it is. I think I already said that, but it can't be anything else. The good thing is that once you have that basic foundation, if there is an opportunity or a job opening, you can move on. And having that foundation, as I said, all that learning and all that experience can help you out a lot. As in my case, me being a medical assistant and having done that for 4.5 years at an OBGYN office helped me out extremely when I went to transition to be a promotora, because not only did I have experience in working with patients with low income, patients who were underinsured, I had the resources to help those patients who needed free mammograms and free pap smears, who needed other services such as DEXA scans and things like that. So, I mean, being a medical assistant is great, and I do love it, and I would do it over again if I had to. But as I said, you need to consider your pros and your cons when you're doing that. Um, that's my presentation for week 5, assignment 1. Thank you.